It's funny how sometimes you can hear about something like a medical condition, and it doesn't really hit home until, you know someone or you hear a story about someone who's actually been through it.
Right.
And that's what this deep dive is about today. We're talking about narrow-angle glaucoma.
Yeah.
We're going to be going through a lot of the stuff that you sent through to us. We've got some articles, we've got some research papers, personal notes.
Yeah. A lot of good stuff.
Yeah, really trying to give us a clear picture of this condition because it's one of those ones that can be, I don't know about you, but for me, it seems a bit kind of mysterious and strange.
Well, and it can have such a big impact, so it's definitely one that we want to get right.
Yeah, for sure. And I think particularly because early detection,
Mm-hmm.
like with a lot of these things, can make a huge difference. And I was reading this case study about this patient, and they just thought they were having really bad migraines. They had like halos around lights, they had blurred vision, even like nausea.
Oh, wow.
And it turned out that it was acute narrow-angle glaucoma.
Wow.
And they ended up in the ER, and luckily they got treated in time.
Oh, that's so good.
But that's the kind of thing, right, where people can dismiss those symptoms as something less serious, and then by the time, well, that's why we're doing this deep dive, right?
Yeah, that's why we need to understand it.
That's why we need to understand it so we know what we're dealing with, how to spot the signs. What exactly are we talking about when we say narrow-angle glaucoma? What's actually going on in the eye?
So essentially the drainage angle in your eye, which is responsible for maintaining that normal fluid pressure, gets blocked. And it's kind of, you can almost think of it like your sink, right? If your drain's clogged, the water backs up.
Yeah.
Same thing in your eye, that fluid builds up and increases pressure inside the eye, which can damage the optic nerve.
And the optic nerve, just for people who don't know, that's what transmits the signals from the eye to the brain, which allows us to see.
That's exactly it. Yeah.
Okay, so it all comes back to that.
It really does, yeah.
It all comes back to the optic nerve. So are there different types of narrow-angle glaucoma?
Yeah, there are. So we've got acute and chronic. Acute is what we were just talking about, that sudden, painful blockage. That's an emergency situation.
That's the get to the hospital one.
Exactly, yeah. And then you've got chronic narrow-angle glaucoma, which kind of sneaks up on you a little bit more, develops gradually and often without any noticeable symptoms.
Oh, see, that's even scarier.
It's a tricky one.
Yeah, that's a tricky one because it's like, how would you even know?
Exactly, and that's where people might not realize there's a problem until it's quite advanced, unfortunately.
Right. Okay. So with that in mind, then, what causes this blockage in the first place?
So there's a few things, but one of the main things is something called pupillary block.
Okay.
And basically what happens is the iris, the colored part of your eye, ends up pressing against the lens.
Okay.
And that stops the fluid from flowing out through the drainage angle.
So it's almost like it's blocking the drain from the inside.
Yeah, exactly, like clogging it up from the inside.
Right. Okay.
And then you've got posterior pressure as well. And this one, it's kind of pressure from behind the iris. So it could be from a cataract, maybe some kind of swelling, but it pushes the iris forward. And again, it blocks that angle.
So it's not even necessarily a problem with the drainage angle itself. It's the fact that something else is
Pushing on it.
pushing on it. Exactly.
Interesting.
And then another one is neovascularization.
I'm gonna be honest, that sounds complicated.
It's a big word, but all it means is abnormal growth of blood vessels. So basically, sometimes these blood vessels can grow in the iris, and guess what? They can also block the drainage angle.
So it's like the body trying to heal itself, growing new blood vessels, but it kind of backfires in this situation.
Exactly. It's a
Yeah.
complex condition. And it gets even more complicated because there are some unexpected risk factors as well. Unexpected. Come on, you can't just drop that on me and not tell me. What kind of unexpected risk factor?
Okay. Well, this one might surprise you, but even certain medications, they can increase your risk.
Really?
Yeah, and even, would you believe it? Even some types of eye drops.
Oh, wow. The very thing you would think
I know, right?
would be helpful.
You'd think it would be the solution, not part of the problem.
Yeah.
But it shows you how important it is to be aware of anything you're taking, even if it seems harmless.
Right.
Another thing is, if you're very farsighted,
Okay.
that can be a risk factor. And as you mentioned before, ethnicity does seem to play a part.
Right. We're talking about people of Asian descent being at higher risk.
Yeah.
Is that a genetic thing or?
It's thought to be, well, we think it's to do with the actual anatomy of the eye. Okay.
So studies have shown that people of Asian descent tend to have a shallower anterior chamber, which is that space between the cornea and the iris.
Right.
And that can make them, more prone to this angle closure.
So it's literally the structure of the eye is slightly different.
A little bit, yeah, which is fascinating, isn't it? It's
Yeah.
not just about genes. It's about how, these small variations.
It's all these little differences.
Yeah, it's all these little differences. And that's another reason why early diagnosis is so important.
Yeah.
Because if you know these things about yourself, well, if we know these things,
Yeah.
it can help, with preventive measures and things.
So how is it actually detected then?
So one of the standard tests, it's called tonometry,
Okay.
and it measures the pressure inside your eye.
It's very quick, totally painless.
Hmm.
They might use a special lens to have a look at the drainage angle and see if it's open or closed. That's called gonioscopy.
So they're literally looking for that clog.
Yeah, they're checking it out. They're looking at the structure, making sure there's no pressure building up. And that's why those regular checkups are so important, particularly if you're over 60 or if it runs in the family.
And if they catch it early, what's the treatment?
Well, luckily we've got a few good options. Medications are usually the first thing, often eye drops.
Right.
And they can either reduce how much fluid your eye's making or they can help it flow out better.
So it's all about that balance again.
All about that balance, yeah. For some people, they might recommend a laser procedure. It's called laser iridotomy.
Okay.
It sounds scarier than it is. Basically, they just use a laser to make a tiny little hole in the iris.
Right.
And that just helps to relieve the pressure, gives it somewhere else to go.
Like a bypass.
Yeah, exactly, like a bypass.
A drainage bypass.
Exactly that. And in some cases, if someone's got cataracts, they might need their lens replaced.
Right.
And that can help with both issues at the same time.
Okay, so we've talked about tests, we've talked about treatments. What about lifestyle changes? Is there anything that people can do to,
Yeah.
sort of be a bit more proactive about it?
Yeah, I mean, obviously the medical stuff's crucial,
Sure.
but those lifestyle things can really make a difference as well. Diet, for example, is massive.
What should we be eating if we're thinking about eye health?
Anything that's packed with antioxidants, vitamin C, E, zinc, all that good stuff. So leafy greens, citrus fruits, nuts, and seeds.
Right. Okay.
And actually, fun fact, lutein and zeaxanthin.
Okay.
They're powerful antioxidants. And you find them in kale, spinach, collard greens. And they've been shown to protect against glaucoma.
Oh, really?
Yeah.
So it's not just about eating your greens, it's about eating the right greens.
You got it.
Wow. Okay. What about exercise? Does that play a role?
Absolutely. Even if it's just moderate activity, it can help lower that eye pressure and even improve the blood flow to the optic nerve.
It all helps, doesn't it?
Yeah.
Are there any other, lifestyle factors that people should be thinking about?
Well, I think we forget sometimes how connected our minds and bodies are. But stress, believe it or not, can actually impact your eye pressure. Yeah, so finding those healthy ways to de-stress, whether it's meditation or yoga or even just getting out in nature, it can make a big difference.
So it's all about that self-care, isn't it? It's not just about your mind, it's about your eyes as well.
Exactly. And this one's really interesting. Even just the way you sleep can have an effect.
Ooh.
Yeah, if you can elevate your head a little bit while you're sleeping, that can actually help reduce eye pressure at night.
See, these are things I would never have thought of that.
It's amazing, isn't it? These little things, they make a difference, especially with a condition like this that's ongoing.
Well, I have to say, this has been a real eye-opener, if you'll pardon the pun. We've covered so much. We've talked about how the eye works. We've talked about the risk factors, the tests, the treatments, what we can do in our everyday lives.
It's a lot to take in.
It is a lot to take in, but if there was one thing that you would want our listeners to really take away from this whole deep dive, what would it be?
Honestly, get your eyes checked regularly. I can't stress it enough. Early detection, it's crucial with glaucoma. The earlier you can catch it, the easier it is to manage and slow down, anything that might be happening.
Absolutely, because knowledge is power in these situations, isn't it? If you know what you're dealing with.
100%. And, don't be afraid to ask your eye doctor questions. Understand your family history. Make sure you're informed. It's your health.
That's such a good point. It's about being proactive.
Yeah.
So on that note, before we wrap up, I've got one final thought for everyone.
Okay.
If you could ask your eye doctor one question about narrow ankle glaucoma, what would it be?
Ooh, that's a good one.
Right.
Something to think about, right?
Yeah.
But for now, that's it for this deep dive. We hope you've learned a lot. And remember, being proactive about your eye health is so important. It's a precious thing. So until next time, stay curious.